So we'll look at another brain condition this evening. So this is what is known as what the posterior reversible encephalopathy syndrome. Posterior reversible encephalopathy syndrome. So for this posterior reversible encephalopathy syndrome, it's just a neurological condition. It's marked by sudden onset of things like headache, the person is having seizures, the person is not seeing well, alright, and the mental status of the person is not kind of like disrupted. You understand? So what causes it? So a lot of things, like the person has had high blood pressures for a very long time. Okay, so the ability of the brain to be able to regulate blood flow is disrupted. You understand? So maybe pre-eclampsia and eclampsia, mostly in pregnancy, because I came across this when I was reading about complications of pregnancy. All right, maybe the person has had renal failure, maybe the person has had autoimmune diseases, maybe the person has an infection that is kind of like spreading the whole body, or the person is taking immunosuppressive or cytotoxic drugs. All right, so symptoms: such a person is having so much headache, there's seizures, there's visual changes, you're having blurred visions and all of that, confusion or altered consciousness, nausea and vomiting. May include what focal neurological deficits like weakness, disturbance, or speech disturbance, just affecting all those things you do with ease. So what happens in the brain? So it involves what vasogenic edema. So there's like fluid leakage in the brain. Do you understand? Now most commonly affect the parieto-occipital lobes, but can extend to the posterior brain or regions though. So of course, if you want to look at all those things that I've listed, the best way to go is imaging. So imaging will help you to what? You see all those places that are whitish, shows that there's what? Fluid accumulation there. You understand? So treatment is what? Supportive care. Try to stabilize the blood pressure, because most of the times it's high blood pressure that are causing these complications. All right, so when you stabilize it, then you give what? Drugs to actually handle the seizures. So anticonvulsant drugs. So patient may recover fully, but delayed treatment can now lead to permanent issues.